The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good day to you. It's another Tuesday for me, and I'm here to record the next episode of TMD Demystified. I am Tony Urbanic. Today, I am going to continue the topic that I started 4 episodes ago, entitled, How Come No One Ever Told Me About This? This is part 5 and will be How Come Nobody Ever Told Me About This, part 5, quote, government. As I've talked about before, this is a multi-part series because that question, how come nobody ever told me about this, with a big question mark, is the most common the most common question that we hear in our practice in Brentwood/Nashville, Tennessee, of which covers pretty much all of Middle Tennessee, and we see on average 80 new referral patients a month, sometimes more, and have over 800, actually over 850 referral doctors and practices throughout Middle Tennessee who send us TMD patients. So, of which I speak is not a small problem, of which I speak I have lots of experience with, and of which I speak I don't exaggerate, and there's no hyperbole involved. I do these episodes to educate and to allow anyone who is interested, but especially my colleagues, my dental colleagues, and hopefully soon maybe medical colleagues, a thorough understanding of this problem of TMD/TMJ in all dimensions. I got into an in-depth study of TMD/TMJ because I felt that surgery was not the answer after operating over 2,000 TMD patients over a period of 35 years. Now that I've been at it and in it for roughly 12 years and have actually figured out what everyone else did not know and did not observe, it is mandatory for me to continue on and make an effort to make my colleagues in the industry, the dental industry and the medical industry, aware of this. Again, I certainly don't want to sound self-serving or self-aggrandizing, and I know the amount of skepticism that is out there in dentistry land, for sure. I can recent comments from 1 or 2 of my colleagues actually confirm that. But this topic that I chose, in a multi-part topic that I'm going to cover, really emphasizes why I do it, and that is, how come nobody ever told me about this? I had, as you may, if you follow me along, you may know I see patients only on Monday at this time and spend the rest of my time, a lot of it, running our TMJ services company, which creates and manufactures and educates on the TMJ device that I developed. But I didn't do this to start a business. I got into this and went down this rabbit hole because I felt that someone needed to take a look at this independently, because I firmly believe that if there's a problem, there's always a solution. I firmly believe that my entire career. And I proved that to myself in so many times as a surgeon and doing surgical procedures. And the only surgical procedure that I was not satisfied with in my entire career, that I eventually gave up on, was TMD surgery. The rest of the surgical procedures, cleft palate surgery, cleft lip, orthognathic surgery, microneural surgery, bone grafting of various kinds, cancer reconstruction, although not very appealing to me, cancer reconstruction was, there were, what you could do was valid. And what I determined after 35 years of TMD surgery was, this is going nowhere. So I went down this rabbit hole, just unintentionally, certainly not trying to develop a TMD device. I went down with the intention of trying to figure it out. And now that I have so much information, so much experience, and the desire to share it with my colleagues, I am now faced with the fact that it is much easier to educate patients than it is to educate doctors. Let me repeat that again. Don't mean to be in your face, doctor, but it is much easier to educate patients than it is to educate doctors. And now treating well over 4,000 people within the past 7 or 8 years successfully with this device and protocol, the most common symptom that the most common question that I am faced with in answering patients is, how come nobody ever told me about this? And I had one yesterday. I have one at least once a week, sometimes several times a week, that asks a very similar, if not identical question, or it's followed up by, as it was yesterday, this patient had just got the consultation. Her history, 45-year-old female, who had seen, by her estimation, 8 other doctors, and had symptoms of TMD going back 15 years, significant symptoms, and she came in, she couldn't stand it anymore. And after the consultation, which included a description of exactly the symptoms and what those symptoms were caused by, which is inflammation within the temporomandibular joint, and a description of exactly how unloading the joint will decrease those inflammations, she not only said, how come nobody ever told me about this, but she said, I can't believe that this is so easy. The only thing I regret is I didn't know this 20 years ago. And that was a statement. And that follow-up statement is frequently connected to the question. So I must address this. And it's a multi-part answer, because when I sat down to try to use it as title for an episode, I realized one episode was not going to cover this. And so we've covered it in multiple parts. I have to remind myself, part 1 was just the introduction, and then we covered the responsible parties of how come the word isn't out. How come it's being, in some cases, unintentionally covered up. I think later on we'll be talking about some issues that may be intentionally covering it up. But the participants here are insurance companies, teaching institutions, large hospitals and medical organizations, venture capitalists, and today we're going to talk about government. I have a lot to say about that. I have a lot of experience on that. And the government itself has responsibility on this. Not that they haven't tried. And I'll give you the example of exactly what happened. And in my own case, I take full responsibility. I want to make it really clear. I am not just preaching because, I haven't been involved. For 35 years, I did TMJ surgery on patients. Some of them were successful. I have patients coming back. I have a file of patients who come back to see me 20 years, 25 years after doing temporomandibular joint surgery on one side using surgical procedures. In fact, a surgical implant that I use very frequently called a Christensen implant. And they've been totally happy and satisfied with the surgical site, but now the opposite side is hurting and they're back for that. And the solution is simple. I just put them in the device. We don't have to do any more surgery. But I also had, starting 12 or more years ago, patients would come back after a year or two after doing surgery, and they would have recurrence of symptoms identical to the symptoms that they presented with. At which point, what am I going to do? More surgery? A different kind of surgery, which can happen. In my experience in my career, going to meetings and talking to other TMJ surgeons, that is not uncommon to have a patient who has multiple procedures, surgical procedures on the temporomandibular joint, which that would be a totally separate episode in describing that and how that worked out for some surgeons or didn't work out for some surgeons and didn't work out for some patients. But to stay on topic here, it's like, what's the responsibility? What's going on with the government as far as answering that question to the patients? Patients have a valid question. They should answer. They should ask that. It's like if you had diabetes and there was a solution to diabetes, but it took patients 15 years to find it, and they had already seen half a dozen doctors, they would say, how come nobody ever told me that there's this thing called insulin? That's exactly the position we're in, doctors, when it comes to TMD. What hasn't been addressed, what hasn't been looked at, what hasn't been examined carefully, what has not been taught in dental schools in any way, shape, or form, is the relationship between inflammation and TMD. That's as simple as that. That's the whole. That is the mile-wide, deep hole that has been there the entire time. And again, I'm not going to go down today and go through inflammation and all its ramifications and how it creates the symptoms, but I'm going to make a comment or a series of comments about what the government's responsibility is on this. So when I say government, I mean government institutions, government research programs, people in government who are aware that there is this big problem, unsolved conundrum called TMD, TMJ. They're aware of it for sure. So in 2019, and I've touched on this before on other episodes, we're going to elaborate on it today, a little deeper dive. And it actually, what I'm going to say today surprises me that it has been so mishandled. But in 2019, specifically in March of 2019, I had been aware that there was a consensus study that was going to be addressed, and a group of the highest level researchers, doctors of all varieties, in multiple specialties in medicine and dentistry and research, that were being called to Washington, D.C. and I believe it was March of 2019, to the National Academies of Science, Engineering, and Medicine. And it was a 3-day meeting where they brought this group of esteemed researchers, doctors in multiple fields that had an interest in solving the problem for TMD, TMJ. Again, because it is the consensus when it comes to TMJ, TMD, the patients and the doctors and the researchers and the academicians know that nothing really works over the long term. That was the consensus. And so they brought a panel of doctors together to first define the problem and then define areas that could be researched and looked into as to what direction needs to be used, and then how to go about doing it, which is very valid scientific kind of information. I won't go into the details of how and why this meeting was called, but it wasn't really called direct. That's the first point. This meeting was not generated directly by the academicians, by the scientists, by anyone in dentistry. It was called literally by an individual who has a website that has complained for years that there is no solution to TMD, and exemplifies and promotes the patients who have been abused by doctors and the system trying to treat TMJ. And I have no argument with that either, because as I've said before, I believe the system that we have been using, educational system, medical system, dental system, inadvertently really has ended up abusing, one way or another, patients with this problem. And if you want to argue with me about that you can do that at any time. But this meeting was called, and generated by literally by the work of an individual who wouldn't give up, and I give her a lot of credit, kudos for never giving up and trying to call a meeting. So I sat in Washington, D.C. beginning in March of 2019, not on the panel. I was not invited to be on the panel, but I invited myself, as there were many others in the room, including representatives from the ADA and the American Association of Oral and Maxillofacial Surgeons, my home specialty group, who wanted to be aware and listen to the proceedings. And so for the first day, I listened to presentations from high-level researchers and different organizations who had an interest in pursuing this. And then I had, with some difficulty, asked for and been allowed to present my information, which by that time had a large group of patients I relied on, literally 3,000 patients at that time, who I'd successfully treated with the Urbanic device and protocol. This thing right here, which is nothing more than a tool which separates the back teeth, which unloads the joint, which decreases the inflammation. And when the inflammation is decreased, the inflammations go away. That's it. And so I was given a short period of time to make a presentation, and in 7 minutes, because I afterward timed my presentation to the panel and the others in attendance in that meeting, I made the case for and brought to the attention of the group of my study and my experience with over 3,000 patients, and the success of that study in treating those patients, to the tune of, depending on how you define success, 85 to 95% of the patients, their symptoms were diminished or gone, and they were totally satisfied over the long term with the solution, which was non-surgical and included a protocol how to use the device. At the end of that presentation, which is available on the internet, on YouTube, and if anyone is interested, I can send you a copy to view, which was actually recorded by the technicians there at the National Academy of Sciences, Engineering, and Medicine in Washington, D.C. When I finished, I got the proverbial clapping, and I sat down and listened to the rest of the meeting, and then went home and waited to see what would happen. I was hoping, because I made it really clear that the studies that needed to be done were studies on inflammation. The studies that needed to be done, the direction that needed to be looked at, was directing the studies toward learning how, or actually a lot of the information is already there. There's not much learning that has to be done. How inflammation creates all the symptoms directly. If you decrease it, if inflammation is the cause, if the root cause is inflammation, and you can get rid of inflammation one way or another, and all the symptoms go away, it stands to reason that you need to study inflammation. and in this case, the specifics of how inflammation creates the symptoms. Well, that study I already did, how inflammation creates the symptoms, and I've talked on it extensively on these episodes. So just refer back to prior episodes, and you can hear about how inflammation within the temporomandibular joint will cause tinnitus, or it will cause upper arm and upper back pain, or it can cause arm, hand, finger tingling and numbness, really strange symptoms coming from inflammation within the temporomandibular joint. However, I made it really clear that inflammation is what needed to be studied, and literally asked the panel to focus on inflammation. And so I went home and waited, and I assumed that, or I hoped at least, that sooner or later, within a relatively short period of time, I'd get a telephone call or an email or a text wanting more information, or taking more initiative from a dental school or a research program or the NIH, who thought studying inflammation as it related to temporomandibular joint was an appropriate thing to do. Well, I waited for 6 months, and after 6 months, I decided the call, the text, the email's not coming. It's not coming. So I went on with what we do here, which is promote the solution to other doctors, to teach them how to treat patients, because I'm only effective in Middle Tennessee. I and my associate in my practice can only be effective in a certain radius, and our radius is in Middle Tennessee, Nashville, Brentwood, Franklin, Tennessee, and surrounding counties. Beyond that, we need other doctors involved. And so I went to work in aligning the service and now the company we have with finding other doctors who are interested in doing this. And we have now a growing company with added doctors and practices throughout the United States. But I had in the back of my mind, I was wondering whether there's going to be any further action from the meeting called at the National Academy of Science, Engineering, and Medicine. After 2 years, finally, the proceedings of that meeting were published. They were published online, and actually they published it in book form. And the first thing I did is bought that book. And I read that book, this book here, Consensus Study Report, Temporomandibular Joint Disorders, Priorities for Research and Care. Subtitle, Priorities for Research and Care. Published by the National Academy of Science, Engineering, Medicine. It runs 409 pages. Very thorough, extremely thorough, all-encompassing. They define the problem well. They define all the people that are involved. They define the problem as it hasn't been solved so far. And after reading these sets of documents, because actually it's a set of documents that are published here, what really surprised me, it did not surprise me that my presentation was not mentioned, or that it was not referred to, or that it was not available as a reference to view on YouTube, and it is a video available. That didn't surprise me, and I didn't take it personally that it was not there. What surprised me was that nowhere in this set of documents, in this book, 409 pages, is there any reference to studying inflammation as at least one of the directions that the solution of temporomandibular joint disease disorder needs to be directed. That surprised me. Actually, that stunned me. Again, at the end of my presentation, it was a short presentation, but it was concise, it was clear, and the call to action was very clear. Please study inflammation. And I got the proverbial clapping at the end. But it went nowhere. And the fact that all those great minds, smart minds, that were in attendance at that meeting, it's like I didn't say anything. They totally missed the point, and they dropped the ball. The answer is they dropped the ball. So, not to complete my presentation today, my episode today, but I just want to make it clear. When a patient asks me, how come nobody ever told me about this? Or I wish I would have known about this 20 years ago. If no one out there who is watching this believes me, if your skepticism is through the roof, I'm okay with that. You can be skeptical as you want. But you can't say at all that I have not tried to bring this to the attention of the authorities, of the government, of my colleagues, who need to know at least what direction to go to. That cannot be said. Or if you want to say it, that's fine. If you want to be civil about it, call me up and say it. You can criticize me all you want. I am certain on what I say. That absolutely stunned me. So when the patient says, how come you ever told me about this? It is not because I didn't try. It's not because I'm not in the game. It's not because I'm not persistent or consistent. And that was in 2019. Here we are in 2023. You know, I've read a couple of things from the NIH, NIDCR, National Institute of National Institute of Dentistry and Craniofacial Research, NIDCR, that are literally responsible. They are the responsible government agency to study TMD problems, and they're aware of it. And there are invitations for people to study TMD via NIH, NIDCR. By the way, others in attendance at that meeting, and not necessarily on the panel, but in attendance, were representatives of the American Association of Oral and Maxillofacial Surgeons, the American Dental Association, the National Institute of Health, the National Institute of Dental and Craniofacial Research. They were in attendance at that meeting also, besides the panel called at the Academy of Sciences, Engineering, and Medicine. So the ball was dropped. Why this is a conundrum to me. Disappointing for sure. Disappointing for sure. I can't say frustrating, because I am not frustrated about the problem itself. I am not frustrated about the solution. If you have a problem, there is always a solution that can be found. If you have an unsolvable problem, you're either asking the wrong question or you're going to the wrong source, meaning you're asking the wrong people, or they're going to the wrong source, or you're asking the wrong question, because there is always a solution to every problem. I believe it. I state it. I will hold it, that concept, forever in my mind and in my actions. So, how come nobody ever told me about this before? This is a huge question, not just coming from Middle Tennessee. And it's a shame. It is truly a shame and a black mark on our medical institutions, our medical services, our dental institutions, our dental services, our dental industry, that a more appropriate action and emphasis has not been taken on this. The medical industry, the dental industries are changing. We all know that. That kind of gets outside the parameters of the purpose of this podcast and the episodes that I have. There's a lot of things I can mention about it that are relevant can be relevant about TMD. And I will just mention one of them. I read a lot. I listen to a lot of highly level people in the medical and dental industry about the changes coming and the changes that are already present. We all know that, we all feel it. And doctors are just like anybody else. We don't like change, especially when we spent so much time on our education and emphasize, exactly how it should be done, used to be done, but things are changing rapidly. Regarding the dental industry and dentists themselves, there is a new, not brand new, but there is a new move afoot to create in multiple states dental therapists. That leads to the fact that within a period of time, likely most, if not all, not all states, and now there are, I just read an article on it, probably enumerated maybe a dozen states that either have instituted some laws allowing dental therapists, meaning other individuals other than a licensed doctor of dentistry, to perform dental maneuvers, extractions, fillings, different dental procedures that by law had to be been done by a licensed dentist. And that process is going to expand into other states, no doubt about it. And within a period of time, I'll only guess how long that will take. Dentists are going to be confronted with the fact that they are literally going to be competing with dental therapists that will need to be, I assume, watched over by a licensed dentist. But the days of dentists being focused only on being tooth mechanics, let's just call them tooth mechanics, mechanically operating on a tooth, are going to be going by the wayside because it can be done less expensively, sometimes more efficiently, by others that do not have to take the time and the broad education of obtaining a doctorate degree in dentistry. And I think that's a good thing. But it also then allows and should allow the doctor of dentistry to expand his horizons, expand his scope, expanding what he looks at as far as actually understanding, have a better understanding, a more significant understanding of the pathophysiology, the pathology of the different diseases. Because if you have a disease, you want to cure the root cause and not just treat symptoms. So, we know the root cause of, or at least one of the root causes of dental decay, and different things that you can do to avoid dental decay, and the pathology involved and the bacteriology involved with dental decay. And the professional doctor of dentistry in the future, I believe, is going to spend most of his time focusing on that kind of thing and not focusing on the dental mechanics of scooping out decay, making a preparation, and filling the tooth with something. Brings us back to TMD. TMD was dropped in the lap of dentistry decades ago and was not even addressed for several decades. They didn't want anything to do with it. And finally, some people in the dental industry, in the dental schools, decided, well, let's take a look at this. Oral and maxillofacial surgeons were actually the first on scene, taking a look at it and doing various types of surgical intervention. We already talked about how that didn't work out. But in this case, doctors of dentistry should know more about inflammation, the basic science of inflammation, and how inflammation causes TMD, and how inflammation is the root cause. And instead of treating symptoms of TMD, trigger points, massage therapy, myofascial kind of things that are done to treat the muscles. Well, muscles don't cause TMD. Inflammation causes TMD. So inflammation is the root cause. So you study inflammation. in an honest attempt to bring that to the leaders of our current organizations in 2019. An honest attempt. And I consider that attempt a failure, but I will go on. And again, disappointed, yes, but not overwhelmed at all. And I hope that over a period of time, there'll be several people who actually understand this problem better and take my information seriously and apply it seriously, because we know that what we do is a solution to the problem. It may not be the only, so somebody may be much more brighter than I and can figure out a better, different way to decrease inflammation in the temporomandibular joint consistently over a long period of time, a much better way than unloading the joint. And that'd be cool. That'd be great. I'd look forward to it. But right now, unloading the temporomandibular joint with a device that disoccludes the posterior teeth according to a protocol over a long period of time that can be adjusted. The device itself can be adjusted, but the use of the device as a tool can be adjusted by the patient according to their need, and consistent with the protocol, which is 24/7 for the first 2 months, and nighttime or sleep time the rest of their life. Because the most common time people brush is at night, not the only time. But if you relieve the loads on the joint consistently 24/7 at first, and then nighttime or sleep time for the rest of their life, it seems to do the trick in 90% of the cases or so. And then some people need to wear it more during the day. All right, well, we won't go into that part of it. That isn't what I'm here to say. So the government organizations definitely have a responsibility to answer that question. It's not my question. It's a question from the public. We're here to serve the public. We're here to serve our patients. We went to school. We got doctorate degrees, or at least we theoretically went through all of that training and knowledge to try to help people. I think there are most of us out there who are doctors in medicine and dentistry still. That's our purpose. There are some that have gone astray. We won't talk about those. But the majority of us, we're still here to help people, and we're not here to do things that do not help people, which is why I quit doing surgery on the temporomandibular joint. Until next time, we're going to cover the next group that answers the question, how come nobody ever told me about this, which is going to be, I'm not sure what the next group is going to be. I have a list, and we'll go on. There's a few more. Pharmaceuticals is at the end. Enough said for today. I look forward to my next episode. I look forward, hopefully, that you will follow me along. Apologize for my rambling, but I think I've made the point more than once. I do appreciate those who stuck to the end. If you'd like to comment or criticize, I can be reached at Tony@tmjservices.net. Our Director of Marketing and Education can be reached at Naomi@tmjservices.net, and our website. If you are interested in becoming a network provider and actually helping patients with this problem in a very simple way, using a very simple tool and protocol, which is focused on inflammation within the temporomandibular joint, you can look at our website information, www.urbanictmj.com. Until next time, I am Tony Urbanic, and this is TMD Demystified.